If you've been struggling with shoulder pain, I completely understand where you're coming from. I myself, as a massage therapist, have also felt this pain. A lot of times it will be sharp in the shoulder and sometimes radiate down into the arm. My clients have also felt this way as well. And they come from various different professions. Some are office workers where they're at the computer all day long. Some are dental hygienists. Some are medical technicians. It just varies. And the common situation is where they're sitting in a posture where their arms are in front of them working with their hands. So it's very, very common across many professions. And through some stretching techniques and some other techniques, my own self-care and structural realignment, I have learned some ways that has really made a huge difference in my shoulder pain. And I actually don't really feel shoulder pain anymore doing these suggestions that I will show in this video. And then I've also showed them to my clients, and it has really helped them out. So what we're going to do in the video today is we're going to discuss the causes of shoulder pain. How does it even happen? Sometimes it can tend to sneak up on people where they think, oh, I just did this one thing and it caused this problem. In reality, what has happened, it's been a series of postural differences and postural compensations that will cause a kind of a misalignment and an imbalance in the system, so that one movement may have just triggered whatever caused the pain. So in today's video, like I say, we're going to talk about the causes, and then we're going to go through and talk about some techniques and different things you can do in your own self-care at home to help your pain either be eliminated or at least reduced. First, we're going to look at 4 causes of shoulder pain. And before I begin, please, I just want to reiterate that if you feel like you've had some major injury or a tear in your shoulder joint or anything like that, please consult with your physician. I'm not a doctor, and this is for information purposes only to help you along. But if it's something very, very serious, please consult with your physician so they can get it checked out for you. The first cause I want to touch on that happens a lot with my clients, I do notice that clients that tend to be side sleepers and work on the computer tend to have more shoulder problems. A lot of times with side sleepers is you're laying on your side and then you're compressing your shoulders and everything together. And that pulls everything forward. It compresses your chest. And of course, in the morning, it's like, oh, what happened? My shoulder, it hurts. Well, it's been compressed, and the nerves and everything here need to be opened up. And when they've been compressed all night long, that can impinge on the nerve and cause shoulder pain in the morning from sleeping. Cause number 2 can be due to a tight chest and tight upper body muscles. So what can happen is the pecs here can get really tight, pull everything in, and then you have your attachments to your muscles, such as your biceps, pulling you forward. So from the side view, it can tend to look like this. So everything is getting compressed here. Everything is getting stretched back here, including these muscles through here, which can cause even tension and soreness through that area as well. So it can kind of be a double whammy as far as where you're feeling the pain. Cause number 3 is due to repetitive strain and overuse, such as working on the computer for long hours, or staring at our phone, or just working with our hands in front, or even something just as simple as carrying a heavy bag on our shoulders. A lot of times, if you're going to school, don't carry books as much anymore, but women definitely carry heavy purses. We tend to put our life in our purse because we want to be prepared for anything, especially moms. So we put that heavy bag on our shoulder, and what happens? The shoulder comes down, it's pulling on all the attachments in the shoulder, and it's leaving you with this lopsided look. So what ends up happening, so you don't walk around going like this all the time, your head starts going like this, so that way you still have a center to work with. And then pretty soon, before you know it, you're having neck problems too, all because this bag is pulling you down on one side, which if you notice, it's also shortening this. So it could even start having problems down in the hip area too, because all this is getting compressed. You're not staying centered on your low back, so it can just ricochet and have a domino effect in other parts of the body because everything's connected. Cause number 4, it could be nerve impingement, which causes a pain down the arm. And some of that actually needs to be checked out by your physician, because sometimes it can actually be coming from a herniation in the neck, and you want to make sure to get that taken care of, because the neck herniations can be extremely painful and get to the point that it's really hard to use your arm at all because it's so painful. So that's something you definitely want to get checked out by your physician. Now let's talk about how we find relief due to the causes that we just described. Well, the first thing to ask is, how do you sleep? Of course, do you sleep on your side, as discussed before, the complications that can cause? One recommendation for doing that is sleeping with a pillow, some type of pillow, because what a pillow does is it tends to keep you from completely compressing down together for your shoulders, so that way you can at least keep one arm up higher. And of course, a pillow between your legs is also recommended for the same principle, from your hips not coming together and getting compressed from your legs coming together. Another thing you can do before you go to sleep at night is do some stretches that we're going to discuss a little bit later. When working on a computer, you want to get up and move around as much as possible, because when we sit, and especially if we're drinking coffee or anything that can be a little dehydrating, what that does is the tissues tend to dry out, and the body needs fluid for movement and to reduce the pain. And what gets that fluid into the tissue is movement. Otherwise, people can tend to have swollen legs from sitting, because the circulation isn't going, the lymph fluid needs to be moving. So it's very important to get up and move around, even if you can, like for lunch, go for a quick walk, maybe a lap or two around the building. Whatever works. Do some stretches, do something to get the body moving throughout the day. Sometimes it can be very challenging. Sometimes we get very focused on the task at hand, or we get behind and we have time frames that we're supposed to stay in. What you can do, that I've heard other people do, is set a timer. And after so long, the timer goes off, and of course it reminds you to get up, move around, drink water, whatever works to get your body in that state of movement. When using a phone, such as for audio calls, where you don't have to look at your phone for a video, what you could do is use a headset, of course, or the speaker. That way you're not sitting there holding your phone, or even if audio, you don't have to look at it, but you're still holding it. So you still have this forward motion of your shoulder in that locked position, holding your phone. So if there's other ways you can make it so you don't have to hold your phone during phone conversations, it's very beneficial that way. As far as carrying heavy bags, what you can do, instead of always carrying it on the right side, maybe switch it over to the left side. Honestly, it's not really all that great to have that much weight constantly on either shoulder, pulling on the joint. Another thing you can do too is also just kind of stick it under your arm onto one side, or carry it, as close to your body as possible. Or of course, backpacks work as well. Now I want to show a stretch that has been very beneficial as far as helping my shoulder pain and the shoulder pain of my clients. So what you do is you take a big bath towel. Most people have these. And what you can do is, when you get done out of your shower, especially at the end of the day, when you get out of your shower and your connective tissue is nice and loose and everything's warmed up, what you can do is you take your towel, you go up and you go back very slowly, and you pump it 2, 3 times. Bring it forward, bring it back, 1, 2, 3. Bring it forward, and as you notice, each time you'll be able to go back farther after you pump it 3 times, bring it forward, and then go back. So eventually, you'll end up being able to go all the way back. And so by doing this, you can see how it really opens the chest. I'll kind of show a side view, so you can see how that really, really opens up the arms, the front of the arms, the underneath the arms. And another beneficial thing you can do, because especially if you're leaning to the side like this a lot, especially if you're leaning in a chair or when you're driving or anything like that, or like I say, that heavy bag pulling your shoulder down towards your hip, so everything is compressed on the side. So by doing this up here, and then kind of bring your legs apart, and then do a stretch just like this, and really stretch that out very carefully, of course. And you'll feel that stretch go all the way down into your hip, especially the front of the hip. And you want to make sure to do both sides, because what happens is you'll usually feel one side will be tighter than the other, which is creating that imbalance that can cause rotations, compressions, your hip to be higher, shoulder to be lower, everything. So this actually gets into a good fascial stretch into your connective tissue that way. And so then another thing you can do is when you're like this, do a cross like that and really stretch into it. So what that does is it helps with any rotations that are going across your back and realigns that. And that is super helpful. And what you can do is after you get done doing that, just go back and go forward again. If you're not able to do the towel stretch because you don't have enough movement in your shoulders and enough range of motion to do that, you can actually start in the doorway. So what you'll do is come on each side of the door and don't arch your back. Just completely just go straight forward and back. And then you can do it in different elevations. So that way you gradually work your way up. And if you're only able just to do one shoulder because there's a problem with the other one, just do one side. Or just do them one at a time. You don't have to do them both at the same time. So this could be another alternate option if you're not able to do that full stretch with a towel. Another thing that complements the towel stretch that I just demoed very effectively is a certain way that I lay on my towels at night between my shoulder blades. And what that does is it helps my shoulders drop back and pushes my chest out. So that way it takes a lot of the pressure off not only my shoulders, but my neck as well. So what I do before I go to sleep is I take a towel, and you might want to experiment with different towel thicknesses and sizes, because you don't want to get one that's too thick because it can actually work against you. So you want to find just the right size. So what you'll do is you'll take the towel and you'll fold it in half, and then you fold it in half again. So you fold it here. And so then when you fold it downwards, try not to make it even, because what that does is it creates too much of a drop off for your spine, your vertebrae. It's too much of a difference. So what I end up doing is I offset it just a little bit. So that way you have more of a gradual type of decrease here for your spine. And then what I end up doing when I lay down, which I'll demonstrate in a few minutes, is I put it here between my shoulders, and then it helps everything drop back when I lay on it. And so then I not only have that towel, but to create a neck roll that goes along the top of it, I take another big towel and I just roll it. I roll it down to however thick that is going to feel comfortable for my neck. And I'll show you now what it will look like when it's laid out on the floor. All right, so as you can see, I have the towels set up here where I have the one where I said I alternated the edges here. So you can see where it's a little higher and then it tapers down. And then with the other one, I rolled it up to where it's a neck roll. Especially I like this technique because you can make it as thick or as thin as you want. And like I say, you want to experiment with the different towels as far as your lower towel, because if it's too thick, it can kind of push you forward too much, and you don't want that. Mine's actually a little thick, but I'm using it for demonstration purposes so you can see the full effect that it has really on it. So when you lay down, you'll lay down to where it's in the middle of your back. So it's in the center. And then of course the neck roll is up here. So you'll want the neck roll thick enough that it will kind of help put the curve back in your neck. And if you are a back sleeper that never moves, I tend to be that way. So this is actually how I sleep, and I don't have any shoulder pain. But if you move around a lot, or if you're a side sleeper, don't try to stay on it this way, because if you're shifted or anything, it can put you in a certain rotation all night, and you don't want to do that. So what you can do is just lay on it for 15 to 30 minutes before you go to bed at night. That way, especially after you do your towel stretch, because when you do this towel stretch, it starts opening that up, and then listen to some relaxing music or meditate or whatever you do to relax. As far as audio wise, I wouldn't sit there holding your phone, because that's going to defeat the whole purpose, because you're bringing your arms forward again. And then it also pulls on your neck muscles, causing neck pain. So you don't want to do that. So just go ahead and put the phone down, maybe even put something relaxing on just your speakerphone if you want, or something in the background is great. So you want to lay here maybe 15, 30 minutes if you can before you fall asleep. You want to be careful that if you do move around a lot, it is very easy to fall asleep like this in this position, especially as everything starts settling back and you start relaxing. But just make sure that you don't sleep this way if you are a side sleeper or you do tend to move a lot during the night. And so the next thing we'll want to do is actually strengthen the muscles in back, because once these are stretched and the chest and the arms are opened up, we want to make sure that the body naturally stays that way. I'm sure if you've ever tried to, just put your shoulders back, it doesn't always stay that way, because what happens is all this is so tight, and the fascia, the connective tissue, is extremely strong. So especially if it's dehydrated. So what it's going to do is it's just going to keep pulling you forward. So you push it back, pulls you forward, push it back, pulls you forward. So what you want to do is once you get this opened up, you want to start strengthening the backside, such as strengthening the upper traps, strengthening the muscles in the scapula here and the shoulder blade. And that way, those muscles will get stronger, and then you can actually just naturally stand straighter, and you don't have to try to force yourself to do it. So a couple exercises that have really helped me include one where you're doing a pull action, and another where you're doing a back extension, but you're bringing and opening everything up in the front as you come up. So there's different pulley weight systems, but you want to get one where you can start here and grab on and then pull back, go forward, pull back, go forward, pull back, and really engage your traps and your triceps, because that will strengthen that whole upper body and gradually get this to go back, your whole chest and everything to open up. And what I usually do as far as reps, instead of doing 20 repetitions of 10 pound, and okay, I did that, now I'm going to do 20 repetitions of 15 pound. If your body doesn't adjust that fast, what you can do is 20 reps of 10 pounds. And maybe next time, once your body is built up to that and feels good, you can do the last 5 pounds being 15 pounds. And then the next time you can divide it in half. Half 10 pound, half 15 pound. And then gradually, eventually you'll be doing 20 reps of 15 pounds. And then you go up to the next weight in the same progression. So I find with my body, it really helped as far as the recovery time. I didn't get as sore. It was more of a gradual buildup for the strengthening of my muscles. And it makes a huge difference as far as how I'm able to stand. Now, the other exercise, like I was saying, is you start out as a back extension. A little tough to show here, but I'm going to do my best. So you start here and you bend forward all the way down. And then as I come up, I go and I stretch like that. And you generally don't want to try to arch your back and engage your core and go back. So again, it's also kind of a double use, because you're getting stretching and then you're also strengthening. And so what it's doing by engaging that whole backside, it's pulling the entire body back and straight up, so you don't have to force it, and it works really, really well. One thing that I find when I work on a lot of people is we've kind of as a society tended to disconnect from our bodies a little bit. Pretty much take a pain pill and move forward, do what you got to do to try to feel better and move forward. So we've kind of, in a way, disconnected what's going on with our body and how we listen to our body. So when doing these exercises and these improvements, don't worry if you can't do it all at once and say, oh, I just want to do it all at once and I want instant pain relief and everything. So what can happen is you just want to be patient with your body. You want to listen to it. You want to be consistent. And over time, through little progressions, maybe just start with a stretch. Just start with one thing at a time and then gradually build on that. And then that way you don't have to beat yourself up because, oh, I can't do all this all at once. So just do a little at a time. Be patient with yourself. Celebrate the small wins. Once you start feeling better, doing the things we discussed, you should feel at least some pain improvement, if not eliminate the shoulder pain. I know the clients that I've worked on and showed the different techniques that I just showed in this video have found a lot of relief. Granted, it's not going to be 100% works for everybody. And like I say, please check with your physician if you suspect there is an injury to your shoulder. That definitely needs to be checked out. Let me know in the comments if there are some tips that you have personally found to help your own shoulder pain that could benefit others that read your comments as well. If this information has helped you, feel free to like and subscribe for more future self-care tips.